David is 68, and something ordinary has quietly become different. He isn't in pain and he doesn't feel sick. Nothing about this feels like an emergency. But standing at the toilet is not what it used to be. The stream is weaker. Sometimes he waits a few seconds before anything happens. Sometimes it stops and starts again. The whole thing takes longer than it did. And often he walks away with the vague sense that there might still be some left. So he reaches the conclusion almost every man reaches. My bladder must be getting weak. That's a reasonable guess. It's also in many cases not the best explanation. Because in a lot of men after 60, the story doesn't start in the bladder muscle at all. It starts at the exit, where urine leaves the bladder. Here's the short version right now, rather than at minute 15. A gradually enlarging prostate can increase the resistance of that outlet. And when the outlet resists more, the bladder has to push harder just to move the same amount of urine through it. Weaker stream, longer time. That hesitation before it starts, that feeling of not quite finishing, those aren't random. They're what flow looks like when resistance goes up. So the question worth answering is this: how does a gland roughly the size of a walnut change the entire experience of urinating? To understand that, you need to know exactly where it sits, because location is the whole story. Let's start with what the prostate actually is, because most men have never had this explained properly. The prostate is a small gland, in a younger man, roughly the size of a walnut. It sits directly below the bladder and in front of the rectum. Most men have never seen a picture of where it actually is, which is part of why this is confusing. Its normal job has nothing to do with controlling urination. That surprises most people. The prostate's biological role is reproductive. It produces part of the fluid that makes up semen. That's what it's for. Urination is not in its job description at all. So why does it matter so much for the symptom we're discussing? Because of one anatomical fact that explains almost everything in this video. The tube that carries urine out of your body is called the urethra. It begins at the bottom of the bladder and runs down and out of the body. And in the first inch or so of that journey, it passes directly through the prostate. Not beside it, not near it. Straight through the middle of it. The prostate wraps around that section of tube like a ring around a finger. Now picture the whole arrangement as a plumbing system, because it genuinely works this way. The bladder is a reservoir, a muscular bag that stores urine and then squeezes to empty it. The urethra is the outflow pipe running from that reservoir, and the prostate is a ring of tissue wrapped around that pipe right at the point where it leaves the tank. When the prostate is small, that ring sits there and nothing much happens. The pipe stays open, but that gland doesn't stay the same size forever. In many men, prostate tissue gradually enlarges with age. This is extremely common, and by itself it is not a disease. It has a name, benign prostatic hyperplasia, often shortened to BPH. Benign meaning not cancer, hyperplasia meaning growth in the number of cells. And notice where that growth tends to occur. It happens in the inner region of the prostate, the part closest to the urethra. So the tissue that expands is precisely the tissue wrapped around your outflow pipe. Now, why does it grow in the first place? That question has a partial answer rather than a complete one. It appears to involve hormones, and specifically the way testosterone is converted into a more potent form inside prostate tissue. That conversion continues throughout life, and the prostate tissue keeps responding to it. It's not caused by anything you did, not by diet, not by activity level, not by how often you did or didn't have sex. This is one of those changes that simply comes with having a prostate and living long enough. That's the mechanical setup. Now let's look at what it actually does to flow. Here's what I want to avoid saying, because it's the version most people picture and it's misleading. The pipe does not get blocked. That word suggests something closed, like a clogged drain. That's not usually what's happening. Urine is still getting through. You're still urinating. The more accurate word is resistance. The channel offers more resistance than it used to. Think about the difference between a hose that's cut off and a hose that's partially pinched. The pinched hose still passes water, but less of it, more slowly, and with more pressure needed behind it. That's much closer to the situation, though I'd stop the analogy there. A hose is rigid, and this system is living tissue that behaves in more complicated ways. And here's something the hose picture misses entirely, which is one of the more interesting parts of this. The resistance at that outlet actually has two separate components. The first is the obvious one: physical bulk, tissue that has grown, and now takes up space around and along the channel. That component is structural. It doesn't change from hour to hour. But the second component is completely different. The prostate and the bladder neck contain smooth muscle. Smooth muscle has tone. It can tighten or relax. And it's controlled by your nervous system, not by any conscious decision you make. So part of the resistance at that outlet is muscular tension, and that part can vary. Hold on to that, because it explains something puzzling that we'll come back to shortly. For now, the practical result, when outlet resistance rises, the flow of urine changes in specific, predictable ways. The stream becomes weaker, because the same pressure now produces less flow through a more resistant channel. Emptying takes longer, for the same reason. You may get hesitancy, that pause before anything starts, while pressure builds enough to overcome the resistance. You may get intermittency, where the stream stops and restarts as pressure fluctuates. There may be dribbling at the end, as the last urine works its way through slowly, rather than being expelled cleanly. And you may feel like you haven't fully emptied, because sometimes you genuinely haven't. Every one of those symptoms comes from the same underlying situation. Not 6 separate problems. One mechanical change producing 6 different signs. That's worth pausing on, because men often report only one of them, usually the weak stream, and treat the rest as unrelated quirks. They're not unrelated. They're the same story told 6 different ways. If you find it useful to understand the actual mechanism behind a symptom, rather than just being handed advice, subscribing helps this channel reach more people. Now here's where most explanations of this topic stop, and where the genuinely interesting part begins. Because if this were purely a prostate problem, one thing should be true. Bigger prostate should mean worse symptoms. And that turns out not to be reliably true at all. Some men have a considerably enlarged prostate, and relatively few complaints at all. Other men have a prostate that's only modestly enlarged and struggle significantly. Prostate size and symptom severity do not map neatly onto each other. That's a well-recognized clinical observation, and it's a genuine puzzle if you think the gland explains everything. So something else must be involved, and it is. It's the bladder. Remember, the bladder isn't a passive bag. It's a muscle, a muscular wall that contracts to squeeze urine out. When the outlet becomes more resistant, that muscle doesn't just give up, it compensates. It generates more pressure, it works harder, and for a long time it succeeds. This is why the change is so gradual, and why men so often don't notice a specific moment when things got worse. For years, the bladder has been quietly increasing its effort to keep the flow looking normal. And a muscle that works harder against resistance responds the way muscles do, it can thicken, which sounds like a good thing. More muscle, more force. But there's a trade-off. A thicker, harder-working bladder wall can become less flexible, less able to stretch and relax comfortably as it fills. And a bladder that is less comfortable holding urine tends to signal earlier and more insistently. Which is why the same man dealing with a weak stream often also develops urgency and needs to go more often. Those feel like 2 unrelated problems. They can come from the same source. Over longer periods, if resistance stays high, the bladder's ability to empty efficiently can decline further. That's when the sensation of incomplete emptying stops being just a sensation and starts reflecting urine genuinely left behind after urinating. So here's the correction to the mental model David started with. He assumed a weak bladder. In reality, his bladder may have been working harder than it used to for years. The pump isn't failing. The pump has been straining against a more resistant outlet. That's a different problem, with a different set of answers. Which brings us to something that confuses a lot of men and makes them wonder if they're imagining things. Why isn't it consistent? Why is one day noticeably worse than another? Some mornings, the stream is nearly normal. Some evenings, it's clearly weaker. Sometimes there's hesitancy, and sometimes none at all. If this were purely structural, if it were only physical bulk, you'd expect it to be steady. It isn't. Remember that second component of resistance I asked you to hold on to? The smooth muscle tone. Muscle tone isn't fixed. It responds to your nervous system, which in turn responds to a great many things. So part of your outlet resistance is variable by nature, and that alone means your flow won't be identical every time. There are other reasons for variation too, and they're worth understanding. How full your bladder is matters. A comfortably full bladder generates a better contraction than one that's barely filled, which is why forcing yourself to go when you don't really need to often produces a disappointing result, and why some men interpret that as their symptoms worsening when it isn't. Position and how relaxed you are can matter. Tension is not helpful for a process that requires muscles to let go. Certain medications can affect it, and this one is genuinely worth knowing about. Some common over-the-counter decongestants can increase smooth muscle tone at the bladder outlet and can make urination noticeably harder for men who already have some resistance. Some antihistamines and other medications with drying effects can also make emptying more difficult. That's not a reason to stop anything you've been prescribed. It's a reason to mention your urinary symptoms to your doctor or pharmacist when a new medication comes up. Fluid timing plays a role, and so do things like caffeine and alcohol, though I'd treat those as modifiers rather than the main story. And there's simply individual variation, which is a legitimate answer even when it's unsatisfying. The useful takeaway is this: inconsistency doesn't mean you're imagining it, and it doesn't mean nothing is wrong. Variation is what you'd actually expect from a system where part of the resistance is muscular. Now let's clear up something that causes a great deal of confusion, because men tend to bundle all urinary symptoms into one complaint. There are really two different families of symptoms, and they tell you different things. The first family is about emptying, weak stream, hesitancy, stopping and starting, straining, taking longer, dribbling at the end, and feeling incompletely emptied. These are the symptoms this video is about, and they point fairly directly at the outlet and the emptying process. The second family is about storage. Needing to go frequently, sudden urgency, waking at night to urinate, those are different. They're about how the bladder behaves while it's filling, not about how well it empties. Now, here's why they get tangled together. Outlet resistance can contribute to both. As we discussed, a bladder working against resistance can become less comfortable holding urine, which produces storage symptoms. So one man can genuinely have both from the same root cause. But, and this is the important part, storage symptoms have a much wider range of possible explanations. Waking up at night to urinate is the clearest example, and it's worth being explicit about. Nighttime urination can involve the prostate. It can also involve how much urine your kidneys produce overnight, which shifts with age. It can involve fluid that accumulated in your legs during the day and returns to circulation when you lie down. It can involve heart conditions, sleep apnea, diabetes, medication timing, or simply drinking a lot in the evening. So if your main complaint is waking 3 times a night, that is a genuinely different investigation from a weak stream. Related, overlapping, but not the same question. And treating them as identical leads people to the wrong answers. Weak flow tells you something specific about the outlet and the emptying process. That's what makes it informative. So what actually helps? And I want to be careful here, because this is where a lot of content becomes a sales pitch. Let me start with what I'm not going to do. I'm not going to recommend a supplement. There are several sold specifically for this, and the evidence for them is generally weak or inconsistent. Some may be harmless, but harmless isn't the same as effective, and taking one can delay a proper evaluation while the underlying situation continues. Here's what actually helps, and the first item is less satisfying than a pill, but considerably more useful. Understanding the mechanism, which at this point you now do, because it changes what you do next. If you believe your bladder is simply worn out, there's nothing to do but accept it. If you understand this as a resistance problem in a system that can be assessed, then it becomes a question with actual answers. The second thing is not filing this under just getting old and never mentioning it. That's the most common outcome, and it's the one worth avoiding. Men frequently live with these symptoms for years without saying anything, out of embarrassment or resignation. And the consequence isn't just discomfort. Symptoms that are progressing deserve to be looked at, because emptying problems occasionally have downstream effects. The third is getting evaluated when symptoms are bothersome or changing. An evaluation is more straightforward than most men expect. A conversation about your specific symptoms, usually with a standardized questionnaire, a urine test, an examination. Sometimes a measurement of how much urine remains after you urinate, done with ultrasound, painless and quick. That last one is genuinely useful, because it answers directly whether that feeling of incomplete emptying reflects actual retained urine. And that distinction matters more than you'd think. The sensation and the measurement don't always agree. Some men feel they haven't finished, and the scan shows their bladder is essentially empty. That's useful information too. It points somewhere different. Others feel reasonably fine, and the scan shows a meaningful amount left behind, which is exactly why this gets measured rather than guessed at. The fourth is knowing that real treatment paths exist, and that live with it is not the only option. I'm going to stay at a high level here, because specifics belong with your doctor, not a video. But it's worth knowing what the categories are, because they map exactly onto the mechanism we described. Some treatments target the smooth muscle tone at the outlet, the variable component. They aim to reduce muscular tension, so the channel offers less resistance. Others target the size of the prostate itself, the structural component. Those work over months rather than days, which is worth knowing so you don't expect an overnight change. There are also procedures ranging from minimally invasive options to surgery, generally considered when symptoms are significant or other approaches haven't worked well enough. And for mild symptoms that aren't bothering someone much, careful monitoring without treatment is a legitimate choice too. Not everything needs to be treated immediately. Which of those makes sense depends on your symptoms, your anatomy, your other health conditions, and your preferences. That's why it's a conversation rather than a rule. A few smaller things can help around the edges, and I'll keep them in proportion. Not rushing, giving yourself time rather than trying to force the process, since straining doesn't overcome resistance efficiently. In fact, hard straining is worth avoiding as a habit. It doesn't meaningfully improve flow through a resistant outlet, and it puts pressure where you don't want it. Some men find that waiting a moment after finishing, then trying again empties a bit more. Being mindful of large fluid volumes right before situations where a bathroom is hard to reach, and reviewing medications with a pharmacist, as we discussed. These are useful adjustments. They are not a treatment for significant obstruction, and I'd rather be honest about that than oversell them. Now let's address the fears, because I suspect several have been sitting in the back of your mind this whole time. Does a weak stream mean prostate cancer? Not by itself, no. And the reason why is worth understanding. The kind of prostate growth we've been discussing is benign, and it typically develops in the inner part of the gland, right where it can affect the urethra. Prostate cancer more often arises in the outer portion, which is one reason it frequently causes no urinary symptoms at all in its early stages. So urinary symptoms are actually a poor screening tool for cancer. That cuts both ways, and it's worth understanding. It means a weak stream isn't evidence of cancer. It also means the absence of urinary symptoms isn't evidence against it. Prostate cancer screening is a separate conversation, with real pros and cons, and it belongs with your doctor rather than being bundled into this symptom. Does a weak stream mean your kidneys are failing? Usually not. Long-standing severe obstruction can eventually affect the kidneys in some cases, which is part of why persistent symptoms deserve evaluation. But that's not the typical situation, and it isn't where most men are. Is your bladder dying? No. As we covered, it's more likely been working harder than usual for years. Is it just dehydration? Drinking more water won't fix outlet resistance, and I'd be cautious about anyone suggesting fluid restriction as a solution that has its own problems. Is weak flow always an enlarged prostate? Also no, and this deserves saying clearly. Scar tissue can narrow the urethra. Certain neurological conditions affect bladder function. Some medications contribute. Inflammation of the prostate can cause symptoms, and occasionally there are other causes entirely. The pattern we've described is common, but common is not universal, which is exactly why an evaluation is more useful than a self-diagnosis. So I'm not going to tell you this is nothing, and I'm not going to tell you it's alarming either. I'm telling you it's a real mechanical situation that's worth understanding and worth mentioning to a doctor. And there are some circumstances that need attention promptly rather than at your convenience. If you cannot urinate at all, despite a full and uncomfortable bladder, that is urgent, not something to wait out overnight. It's called acute urinary retention. It's usually quite painful, and it needs prompt medical care. Fever or chills alongside urinary symptoms needs prompt attention, because that can indicate infection. Visible blood in your urine should always be evaluated, even if it happens once and then stops. Severe pain in the lower abdomen, or feeling genuinely unwell, along with urinary symptoms, warrants medical care. And repeated urinary tract infections are a reason to look into what's happening, rather than treating each one separately. There's a mechanical logic to that last one, by the way. Urine that consistently sits in the bladder rather than being cleared out gives bacteria more opportunity than urine that gets flushed away regularly. None of that is meant to frighten you. Most men with a gradually weakening stream are not in any of those categories. But knowing the difference between mention this at your next appointment and go now is genuinely useful information. So let's come back to David. He doesn't need a supplement, and he doesn't need to panic. He also doesn't need to quietly accept this for the next 20 years. What he needed was an accurate mental model, and now he has one. He understands that the prostate wraps around the tube leaving his bladder. He understands that tissue growing there increases resistance rather than creating a simple blockage. He understands that part of that resistance is structural and part is muscular, which is why some days are better than others. He understands that his bladder has probably been compensating for years, working harder, not failing. He understands why the stream weakened, why it takes longer, and why the sensation of not finishing can be real rather than imagined. He knows that his weak stream and his occasional nighttime trips are related, but not the same question. And he knows that this is worth raising at his next appointment, with specifics rather than a vague complaint about getting older. That last part is the practical difference. He can now describe what's actually happening, instead of just saying he's slowing down. And if it helps, here's roughly what's worth mentioning when he does. When the change started, and whether it's been getting worse, whether the difficulty is in starting, in the strength of the stream, or in feeling finished, whether he's waking at night, and how many times, whether he's had any infections, any blood, any pain, and what medications he's taking, including anything bought without a prescription. That's a 5-minute conversation that gives a doctor far more to work with than things are slower these days. So here's what's really going on when the flow gets weaker after 60. The problem is usually not that your bladder forgot how to work. It's that your bladder has been pushing urine through a system that gradually became more resistant. The gland wrapped around the outlet grew. The channel offered more resistance. And the pump compensated for as long as it could. And the weaker stream you're noticing is what that whole arrangement looks like from the outside. It's mechanical, it's common, and it's explainable. And once you understand it as a system rather than a personal decline, it stops being something to feel embarrassed about. It starts being something you can describe accurately, ask about clearly, and actually do something about.